Diabetes doesn't mean you have to give up wonderful cuisine. It just means you have to make better choices. In this video, you'll learn about the top 3 vegetables that every diabetic should eat on a regular basis. These are clinically wise choices that are full of fiber, antioxidants, and healing nutrients that work with your body. If you're tired of feeling lost or defeated every time you sit down to eat, this is your moment of clarity. Over 88 million Americans are pre-diabetic, and the majority are unaware that the right vegetables can do more than just keep you full. They can lower blood sugar spikes, improve insulin sensitivity, and even protect your vital organs. Let's begin with the top vegetable that diabetics should consume: spinach. With a glycemic index of only 15, spinach provides your body with deep protective support and is one of the most potent vegetables diabetics can eat. Because it doesn't spike your blood sugar, you can enjoy it without worrying about unexpected highs or crashes. 1 cup of cooked spinach has only about 23 calories, but it is packed with nutrients that can help manage diabetes and its consequences: magnesium, potassium, folate, vitamin K, vitamin C, iron, and antioxidants like beta-carotene and lutein are abundant in its nutritional composition. About 150 milligrams of magnesium, which is important because low magnesium is linked to insulin resistance and poor blood sugar control, and 800 milligrams of potassium, which lowers blood pressure and lowers the risk of heart disease, a condition that diabetics are more likely to experience, are found in 1 cup of cooked spinach. The 4 grams of fiber in spinach also slows down the absorption of sugar, preventing those dangerous after-meal sugar spikes that damage blood vessels and organs over time. Additionally, spinach contains alpha-lipoic acid, a compound that improves insulin sensitivity and lessens diabetic neuropathy symptoms like burning pain or numbness in the hands and feet. Spinach's antioxidants lessen oxidative stress, which subtly exacerbates diabetics' nerve damage, renal strain, and heart disease. Its vitamin K keeps arteries flexible and promotes good blood coagulation, preventing the accumulation of plaque that causes heart attacks and strokes. Because it is naturally low in sodium and phosphorus, spinach is safer for diabetics who already have kidney problems. It is also rich in iron and folate, which promotes the production of red blood cells and helps prevent the weakness and fatigue that many diabetics experience. Additionally, spinach is gentle on the kidneys, which is important because high blood sugar can gradually damage the kidneys over time. Because it contains a variety of micronutrients, it also supports mental health, enhances digestion, and keeps your skin looking radiant when your kidneys or blood sugar are out of balance. From the rich leafy goodness of spinach to another powerhouse vegetable that's low in carbohydrates but packed with fiber and nutrients, spinach is not only safe for anyone managing diabetes, but it's also a wise healing choice because it's soft, easy to chew, and can be blended, cooked, or eaten fresh in a variety of ways. Every bite provides your body with gentle, steady support without adding stress. Cauliflower is an adaptable vegetable that gives diabetic-friendly recipes a whole new level of flavor. Cauliflower comes in second. With a glycemic index of 10, cauliflower is one of the healthiest vegetables you can eat for diabetes, but it does much more than just fill your plate. Cauliflower is one of the lowest GI vegetables available since it little impacts blood sugar levels after meals. This is important for people who want to prevent blood vessel damage and insulin strain caused by sugar surges. The ability of cauliflower to simultaneously protect several systems, especially when consumed regularly, is what gives it its potency. There are roughly 25 calories in 1 cup of cooked cauliflower, Rich in vitamin C, vitamin K, folate, and choline, it contains 3 grams of fiber and 2 grams of net carbohydrates. Additionally, it offers trace levels of potassium, phosphorus, and magnesium. Fiber helps decrease the rate at which glucose enters your bloodstream, reducing pancreatic pressure and improving glucose control after meals. This lowers insulin demand and can aid individuals with insulin resistance, particularly when paired with other low GI meals. Natural plant substances found in cauliflower, such as glucosinolates and their active form isothiocyanates, have demonstrated promise in lowering inflammation and enhancing cellular insulin sensitivity. These substances may shield insulin-producing cells from harm brought on by persistently elevated blood sugar levels. Cauliflower's antioxidant content also helps control oxidative stress, one of the main causes of diseases such diabetic nerve damage and heart disease. About 40 milligrams of vitamin C per cup of cauliflower supports blood vessel health, fights against oxidative stress, and lowers silent inflammation that exacerbates heart strain and neuropathy. Its vitamin K level helps control calcium accumulation and maintain arterial flexibility, lowering the risk of arterial stiffness, which is frequently associated with diabetes. Despite being frequently disregarded, choline contributes to brain and nerve transmission that protects nerves, particularly in situations where blood sugar levels are unstable. Because cauliflower is naturally low in potassium and phosphorus, it is easier for the kidneys to process without increasing electrolyte imbalances and doesn't overload the system, which is especially beneficial for those who are beginning to see early signs of renal trouble. After seeing how cauliflower helps maintain stable blood sugar, let's examine how its water-rich composition and sodium gently promote hydration and toxin clearance, easing the burden on the kidneys and cardiovascular system. Another nutrient-dense vegetable that is high in fiber and potent antioxidants to help manage your diabetes is Brussels sprouts. Brussels sprouts, number 3. With a glycemic index of about 15, Brussels sprouts are a nutrient-dense vegetable that has significant advantages for diabetics. They only slightly raise blood sugar levels after meals. Sharp sugar spikes that might harm blood vessels and exacerbate insulin resistance are avoided thanks to this low GI. Maintaining stable blood sugar levels is essential for preventing complications from diabetes, and Brussels sprouts assist in doing so. There are roughly 56 calories in 1 cup of cooked Brussels sprouts. Only 8 grams of net carbohydrates, 4 grams of fiber, 4 grams of protein, and about 11 grams of carbohydrates. The fiber in Brussels sprouts slows digestion and sugar absorption, reducing the strain on your pancreas and promoting better blood sugar control. They are also a great source of vitamin C, vitamin K, folate, and chromium, a mineral that is known to improve how your cells respond to insulin, making sugar easier to use. Strong substances like sulforaphane, which lowers inflammation and oxidative stress, 2 main causes of insulin resistance, are also found in Brussels sprouts. This component promotes better insulin signaling, which enables your body to better regulate blood sugar. Brussels sprouts contain alpha-lipoic acid, a natural antioxidant that enhances nerve function and can slow the progression of kidney neuropathy. Research also suggests that sulforaphane may also protect nerves from damage, lowering the risk of diabetic neuropathy, which causes tingling, numbness, or pain in your hands and feet. Naturally low in phosphorus and moderate in potassium, Brussels sprouts are a great option because their antioxidants shield kidney tissues from damage brought on by inflammation and high blood sugar. They also have a low sodium content, which helps prevent swelling and high blood pressure, which are common problems in people with diabetes and kidney disease. Additionally, Brussels sprouts promote heart health. The high vitamin K concentration reduces the risk of arterial stiffness by maintaining vascular flexibility and preventing calcium accumulation. Fiber lowers LDL cholesterol, while antioxidants lessen inflammation, which leads to the development of plaque and heart disease. Together, these nutrients make Brussels sprouts a heart-healthy food that shields you against some of the most deadly consequences of diabetes. Folate also helps decrease homocysteine, a substance associated to an elevated risk of heart disease. The top 3 vegetables for diabetes are now known to you: Brussels sprouts, spinach, and cauliflower. But here's the exciting part. How can we make these into a delicious breakfast that you'll truly want? Let's explore some delicious and clever ways to start the day without raising your blood sugar levels. Let's begin with breakfast recipes for spinach. In the first feta omelet, mix together 2 whole eggs, crumbled feta cheese, and a handful of chopped spinach. Add a little olive oil to a non-stick skillet and sauté gently until frothy. This combination provides a low-carb, high-protein breakfast that is high in calcium and fiber to stabilize blood sugar levels and prevent hunger pangs. Mix half a cup of plain Greek yogurt with 1 cup of fresh spinach, a splash of unsweetened almond milk, and a spoonful of chia seeds. Rich in fiber, probiotics, and protein, this creamy smoothie is a satisfying and revitalizing way to start the day. It also helps with blood sugar regulation and digestion. The third wrap with turkey sausage. Add cooked turkey sausage and softly sautéed spinach to a low-carb whole wheat tortilla. For a portable breakfast full of lean protein, fiber, and vital vitamins, roll it up. Let's make cauliflower breakfast recipes, which are ideal for hectic mornings when you want something quick, delicious, and blood sugar friendly. Breakfast bowl with rice and eggs. Ice-sized pieces of cauliflower florets are pulsed, then softly sautéed with a dash of black pepper and turmeric. Add a poached egg on top and some freshly cut cilantro or parsley. This filling, light lunch is high in protein and fiber, which helps maintain stable blood sugar levels. Second cheese frittata. Add a handful of shredded low-fat cheddar cheese and fresh herbs to beaten eggs, then cook small cauliflower florets until they are soft. This frittata, which can be baked or cooked on the stove until set, adds fiber, vital vitamins, and a substantial protein boost to a well-balanced breakfast. This savory hash, which is low in carbohydrates but high in protein and fiber, is ideal for maintaining blood sugar stability and energy levels throughout your hectic morning. Let's move on to breakfast ideas with Brussels sprouts. Third, make smoked turkey hash by sautéing grated cauliflower with diced smoked turkey, chopped onions, and a pinch of paprika until golden and fragrant. Lean turkey sausage, Brussels sprouts, and a dash of garlic are sautéed in 1 skillet. This combination provides a substantial amount of fiber and protein, which helps to maintain blood sugar levels and prevent hunger throughout the morning. Second, the stir-fried chickpeas. Stir-fry Brussels sprouts with chickpeas and seasonings like turmeric and cumin. Because the chickpeas provide plant-based protein and fiber, this dish out is gratifying, nourishing, and ideal for blood sugar regulation. Diced Brussels sprouts are cooked in the third paneer hash with paneer Indian cottage cheese and a dash of black pepper. Brussels sprouts contribute fiber and antioxidants, while paneer supplies protein and good fats, resulting in a tasty lunch that promotes insulin sensitivity. Don't allow the wrong vegetables to reverse your progress if these potent vegetables are keeping you on course. Some veggies may appear nutritious, but they can actually raise blood sugar levels. Stay tuned as we reveal the top 7 vegetables that diabetics should limit or stay away from, as they can seriously impair blood sugar regulation and diabetes health. Potatoes come in first. 1 medium potato can contain about 37 of carbohydrates, And because they have a glycemic index of up to 111, your blood sugar can spike sharply within an hour. Potatoes, whether white, red, or russet, may seem innocuous, but they are packed with fast-digesting starch that turns into sugar almost instantly. Whether they are mashed, fried, or roasted, the result is the same: a sharp rise in glucose that stresses your insulin. Even boiling potatoes don't slow down that rush, and they don't include fiber to balance the absorption of sugar. So if you're trying to prevent diabetic damage to your kidneys, eyes, or nerves, potatoes may be working against you without you even realizing it. A cup of cooked sweet corn contains about 27 grams of carbohydrates, most of which are quickly converted to glucose. Whether it is boiled, grilled, or creamed, corn has a glycemic index of about 60, which is sufficient to push your blood sugar levels outside of the safe range. Corn may appear healthy and natural, but don't be fooled by that. Even popcorn, which is high in fiber, can cause surges if portion amounts aren't monitored. For diabetics, especially those with insulin resistance, canned or frozen versions frequently have extra sugar or salt, which exacerbates their condition. The progress you're trying to accomplish can be subtly undone by corn. Despite their high vitamin content, beets aren't always the greatest option, particularly for diabetics. Compared to many non-starchy vegetables, 1 cup of cooked beets has roughly 13 grams of natural sugar and 17 grams of total carbohydrates, which can elevate blood glucose levels more quickly. Their glycemic index is moderate, that's few, at 4, but their glycemic load is lower, indicating that even while they contain antioxidants, folate, manganese, and other nutrients, they lack protein and fiber, which slows the absorption of sugar for people trying to prevent blood sugar increases. Beetsy should only be consumed in small amounts, or they can be swapped out for lower GI veggies like parsnips. Although parsnips have a high glycemic load, they look like pale carrots. While parsnips may appear harmless in soups or roasted dishes, even small servings can cause significant spikes in blood sugar levels because they contain about 24 g of carbohydrates per cup and have a glycemic index of nearly 97, which is extremely high. Additionally, they don't provide enough protein or fiber to help diabetics who are experiencing insulin resistance or blood sugar spikes. It's possible that parsnips are subtly raising blood sugar levels. Pumpkin number 5. Pumpkin may appear to be a safe and healthful option, but don't put too much faith in it. With a moderate to high glycemic index of 60 to 75 and roughly 20 grams of carbohydrates per cup, cooked pumpkin might cause blood sugar levels to rise more quickly than you might anticipate. Canned pumpkin, which frequently appears in baked products and soups, might conceal extra sugars that worsen the situation. Pureed pumpkin digests rapidly and releases a lot of sugar into your circulation. Pumpkin's high carbohydrate content can cause noticeable blood sugar spikes if it isn't balanced with protein or fat. If you want to avoid sudden energy crashes or blurred vision, pumpkin, especially in processed or hidden forms, can work against you covertly. However, it is also rich in vitamins A and C, fiber, and antioxidants that support overall health. Carrot number 6. Although they are frequently regarded as a healthy snack, raw carrots have a low glycemic index of about 16, which means that they boost blood sugar levels gradually. When cooked, however, their GI can rise to 85, resulting in quicker blood sugar spikes. About 12 grams of carbohydrates and 3.6 grams of fiber, which slows the absorption of sugar, are found in 1 cup of raw carrots. They are also high in vitamin A, antioxidants, and other minerals that boost immune and eye health for better blood sugar regulation. Carrots are best eaten raw or mildly cooked, and portion levels should be carefully monitored. 7 sweet potatoes Sweet potatoes can be challenging for diabetics because their GI can range greatly from 44 to 94, depending on the type and cooking technique. For instance, boiling lowers the GI, while baking or frying greatly increases it. About 24 grams of carbohydrates, largely from starch that converts to sugar, are found in one medium sweet potato. Although they are high in antioxidants, fiber, potassium, and vitamin A, which promote eye health and lower inflammation, they have the potential to induce sharp spikes in blood sugar. To delay the absorption of sugar, sweet potatoes should be consumed in moderation and balanced with protein or healthy fats. Thank you for watching. Now that you are aware of the top 3 veggies that can actually improve your blood sugar and general health, as well as the top 7 vegetables you should stay away from, it's time to incorporate them into your regular meals. Keep in mind that diabetes management is a journey, and every wise decision matters. We're making every meal a step toward better living. So if you found this video helpful, hit the like button and share it with someone who needs it. Don't forget to subscribe and enable notifications so you never miss any easy yet effective ways to maintain your health.